Every year, October 15 comes along and the same dilemma. Keep Medicare Original and switch to Medicare Advantage, or vice versa. What are the differences, pluses and minuses, and are there tips to help you along? Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. But first, what is Medicare? It is the government health agency that is available for folks over 65 years old or those who are disabled, have chronic kidney disease, or ALS. There are basically two kinds. One is called Original or Straight. The other one is called Advantage or Part C. Medicare Original or Straight covers Parts A and B. Part A would be the care that you receive as an inpatient in a hospital or skilled nursing facility, and also for some hospice care or home health services. Part B covers all the professional services, doctors, ambulances, but also supplies, labs, tests, imaging, and outpatient care, even if in a hospital. What Medicare Original or Straight does not cover is dental, vision, hearing services, most routine physical exams, as well as services that are rendered by a medical provider who has opted out of a Medicare network, basically out of network services. And another big thing that Original Medicare does not cover, it is the prescriptions that you would get at a pharmacy. That is Part D. Now, Original or Straight Medicare is administered by CMS, the Center for Medicare and Medicaid Services. They administer the plan, they set the policies, they process and pay your claims, and they also ensure that the significant rights Medicare members enjoy are abided by. In contrast, Medicare Advantage, also called Part C, covers Parts A and B, as well as usually Part D, the prescription plan. By law, they must cover at least the same services, items, and care that Original Medicare covers. But those plans are administered by private commercial carriers, Aetna, Humana, Blue Cross Blue Shield, United Healthcare, and so on. They get paid the premiums to provide the care and pay your claims instead of CMS. Now, Part C, Medicare Advantage, basically functions the same as a commercial plan. They may impose limits and requirements for services and force you to rely on a stricter, smaller provider network. So there are advantages and drawbacks for each type of Medicare plans. Let's start with Original. Original Medicare members love this plan. Why? Because it has the largest network of providers in the country. With Medicare, you do not choose to participate. You are participated unless you opt out, and you must do so by affidavit every couple of years. So basically, just about every provider in the country belongs to the Medicare network. There is no need for pre-authorization, no need for referral by a PCP, and you can go anywhere in the country to receive services. Access to care is easy and immediate. All you need to do is make an appointment and voila, you see a Medicare doctor. Emergency coverage outside of the U.S. may be limited, but it does apply. Providers usually do love Medicare. I know I did as a billing manager. Why? Because billing Medicare is a straightforward and easy process, and you get paid within 14 days. Patients know exactly how much liability is going to be their responsibility. 20% for professional services, and there's a daily rate for inpatient or Part A services. As for the covered items and services, there is a clear list of medical policies as well as descriptions of services that can be perused anytime you go on Medicare.gov. Now, of course, there are some drawbacks. Because it only covers Part A and B, you must purchase a separate Part D policy for prescription drugs. And if you wish, vision, dental, or even hearing coverage must also be purchased separately. And to cover the share of the cost, for example, the 20% for professional services, a Medigap or secondary policy is also something you must get. And while there is a limit on prescription drug copays, there is none for the actual share of costs, especially the 20% for Part B. But again, if you have a Medigap or secondary policy, that should cover that cost. As for Medicare Advantage, there is a yearly maximum out-of-pocket liability, and there's usually no deductible. The federal government imposes that annual cap for out-of-pocket expenses, whether in or out of network. Usually, Medicare Advantage plans offer vision, hearing, and prescription drug coverage as well as dental care for the same premiums or for a low-cost add-on. It may even include some perks like gym memberships or wellness and prevention programs. Members of Medicare Advantage plans like the one easy-to-manage plan, just one instead of Part A, Part B, and Part D. And Part C may also cover more services than original Medicare. But there are disadvantages. The network of providers is limited, local, and very strict. It is often difficult, if not impossible, to receive services outside of that network unless at your own cost. Authorizations or referrals from your PCP, even to go see a specialist, are a usual requirement. And your PCP or your insurance can limit access to care based on specific requirements. Advantage plan members have complained about delayed access to care or fighting to get a referral. And the narrow choice of local providers has sometimes led to subpar care. Now, those members have basically the same complaints as those for commercial plans. The system basically is the same. But for Medicare Advantage, out-of-network services may not be covered or very poorly paid. And they are not allowed by law to buy an additional Medigap or secondary insurance to cover any share of cost. As for medical providers, many will refuse a Medicare Advantage plan or card and prefer to consider you self-pay. Payment delays are common, low reimbursements as well, which leads fewer doctors to contract with Medicare Advantage plans. Let me offer some tips to help you along. If you choose an Advantage plan, you have the choice of a PPO or HMO version. Yes, it's the same as a commercial plan. So if you want to continue seeing the same specific physician, especially a PCP, and if that PCP or provider is already in the Advantage plan as a in-network provider, and if you're already familiar with the process, then good for you. Continue. I know sometimes we get busy, time passes, but October 15 to December 7 is when you can switch from original Medicare to an Advantage plan, or vice versa, when you can switch from one Advantage plan to another and enroll in, switch, or drop your drug coverage, Part D. And make sure to ask for help if you need it. Medicare.gov is your destination to find plans in your area, to get answers to your questions, and to speak to a real person who can help present your options and help you make the best choices. And don't forget, financial help is available to help pay the Medicare premiums or secondary coverage or even those prescription drugs. Last but not least, be wise. You can only change plan once a year. So whatever you plan on for next year, make sure it best meets your needs. And in healthcare, everything has an exception. So even though the open enrollment period ends on December 7, if you are already enrolled in a Medicare Advantage plan, or if you just got eligibility in the past 3 months, you can switch from one Medicare Advantage plan to another or drop it to return to Medicare Advantage between January the 1st and March 31st. And last, I know you heard me say it 100 times already, but I love Medicare.gov. It has every single piece of information you may ever want and more. It's a treasure trove of answers as well as good advice. And don't forget those navigators there to help you. I so thank you for watching. Your comments, your likes, your subscribes do help this little channel grow a little bit more at a time to reach out to more patients like you. So thank you.